Multiple sclerosis is heralded by difficulty or slowness of nerve conduction down the axon. Heat further slows that down. So sometimes in the summertime, people with MS are more aware of their symptoms. They feel that they have less energy reserves. They might have more reminders of their MS in terms of their symptoms being a little bit more of an issue. And it's really important for them to try to pace themselves, conserve energy, keep themselves cooler, and to talk about symptom management as well as treatment of their MS with their neurologist, because they can be much more effective in terms of treating their MS, which will certainly help them during the summertime as well. So people with MS have such a variety of symptoms. No two people are the same, but because MS affects the central nervous system, which is really any part of the brain and any part of the spinal cord, people can have a whole host of symptoms. Fatigue is incredibly common, sometimes visual problems or sensation problems, weakness, balance, difficulty with walking. And again, it's really, really important to try to manage those to improve people's quality of life, but also to intervene in terms of MS management itself and stave off disability change, stave off active relapses and inflammation, and really do the most that they can to try to keep their MS at bay. Therapies have become much more effective at accomplishing that. Lemtrada is one of the newer products we have on the market, which is very, very effective at keeping people quiet and keeping their MS much more stabilized. The Lemtrada has been out almost for 2 years now. It was approved in November of 2014. It's an IV therapy for MS, very effective therapy. It's given in 2 annual doses. It's a 5-day course the first year, and the next year it's a 3-day course. And people, have to have side effects managed sometimes from the infusion itself. Then there are some long-term monitoring of things that can happen down the road, autoimmune conditions of the thyroid and platelets that we monitor for. But people really do very, very well. It's really what I kind of describe to my patients as a reboot of the immune system, to make their immune system better behaved, if you will. Highly effective at decreasing relapses and keeping people much more stabilized in terms of disability progression from MS. So treatments of the past, which have been around for a couple of decades, were minimally effective, but with every incarnation of newer therapies, we seem to be able to accomplish higher efficacy in terms of staving off change from MS, and that's really the goal. That's the name of the game, is to decrease inflammatory attacks, which result in damage to the nervous system. So if we can really stave that off and curtail that, we can have people doing very well and keep them, in my words, less aware of their MS, which is ultimately the goal. It's really important for people who have MS to understand what their treatment options are, to be proactive about their care, and to really take part in active dialogues with their healthcare team, to really make sure that their symptoms are appropriately managed to improve their quality of life, and to make sure that they're on the most effective therapy for their MS. Again, everybody's different in terms of how they manifest MS, but with such highly effective therapies on the market, there's really so much to talk about, and I would really urge people to take part in those active dialogues with their healthcare team for better, more effective treatment.